Our article, MS Care Integrated Advanced Therapies and Holistic Management, has been recently published with my co-authors. I'm very grateful for them to contribute to the content and to help me to publish this paper. I'm very great fan in terms of the lifestyle medicine and holistic approach towards the patients with MS care. I think it's essential for any subspecialty in neurology. So our objective for this article and our paper was to explore how lifestyle and environmental factors impact the health and disease progression in patients with multiple sclerosis. We aimed to identify key determinants such as lack of exercise, poor diet, smoking, excessive alcohol drinking, social determinants of health, symptom management, medications that we use for sleep and comorbidities, and also menopause. The goal was to present a comprehensive approach that integrates advanced therapies, such as disease-modifying therapies, with holistic management strategies to preserve neurological reserves and improve outcomes in people living with multiple sclerosis. And this approach promotes a brain healthy and metabolically healthy lifestyle to slow disease progression and enhance the quality of life for those living with MS. Our paper provides several recommendations for self-regulating lifestyle modifications for patients with MS. So first of all, and very important, is exercises. And we recommend to engage in regular physical activity, tailoring individual capabilities. So one size does not fit all, so it needs to be adapted depending on your ability. Or patients' ability to do exercises. That includes aerobic exercises, resistant training, activities like yoga, swimming. Also, we touch the base on diet. We recommend to adopt a high-quality diet, rich in organic, seasonal, fresh, and plant-based foods, including organic meat, oily fish, nuts, seeds, legumes, healthy oils, avoiding processed and ultra-processed foods with excess of salt and sugar. Also, we discuss about the smoking impact, and smoking cessation has been advised to quit up smoking to reduce the risk of the rapid disease progression. And as a consequence, if you continue smoking, that increases the disability. So we have to emphasize that during our clinical consultation, and also we discuss about the moderate alcohol consumption. Limiting alcohol intake to recommended levels is essential. Sleep is super important for people living with MS for general symptom management and overall well-being. So maintaining the good sleep practices, including regular sleep schedules and conducive sleep environment and sleep hygiene, as we say, is super important living with MS. Emotional well-being is another area that we explored, and we encourage people to engage with activities that improve their mental health, such as meditation, yoga, maintaining social connections, being around the people, having all that support, and if necessary, getting some counseling and some psychotherapy or psychology input. Also, we covered the prevention of infections. As we know, infections can drive and increase the activity of MS disease, and sometimes we may mislabel that as a relapse, but in reality it's a relapse, that pseudo relapse that people present with exacerbation of the symptoms. So prevention measurements should be in place to manage the infections and also avoid the infectious processes for people with MS. So I think, yeah, that's about it, to be honest.